Doctor, I saw on the internet that there are special exercises that can reduce minus. Is that true? We hear this question very often at Ko'z Nuri Eye Clinic, especially from young people and parents. Because no one wants to wear glasses. No one wants their minus to increase. That is why people hold on to the hope that vision can be restored naturally through exercises. Let's answer this question openly and honestly. Can eye exercises reduce minus? The short answer, no. Eye exercises cannot anatomically reduce myopia, which means minus. Now let me explain why. What is myopia? In myopia, the eyeball is slightly longer than normal, or the optical system of the eye is too strong. As a result, the image focuses not on the retina, but in front of it. In other words, the problem lies in the physical structure of the eye, in its shape or optical power. Exercises cannot shorten the eyeball. It is impossible to shrink the eye back. This is similar to trying to reduce your height through exercise. Anatomical changes cannot be reversed with exercises. Does that mean exercises are completely useless? No. There is a very important nuance here. Eye exercises do not reduce minus, but they can reduce eye strain. For example, when working for a long time on a phone or computer, the eyes constantly focus at a close distance. This leads to accommodation strain. As a result, a person may notice blur even when looking far away. Sometimes, this can create a temporary false minus. In such situations, simple exercises, looking into the distance, giving the eyes rest, blinking frequently, following the 20-20-20 rule can help. The eye muscles relax, fatigue decreases. The person feels relief. But this is not treatment of true myopia. What do we see on the internet? -5 became 0. I walk without glasses thanks to exercises. I restored my vision 100%. Such headlines are very common. However, in evidence-based medicine, these methods are not scientifically confirmed. What usually happens? A person actually has accommodation spasm, meaning temporary overstrain. After doing exercises, the spasm decreases. Vision seems slightly better. The person thinks, my minus decreased. But in reality, the minus did not change. There is another dangerous aspect: believing in exercises and postponing proper examination. This is especially dangerous in children, because myopia in children can progress quickly. If it is not controlled in time, the minus can increase rapidly. It must be clearly stated, if the eyeball has elongated, exercises will not shorten it. To correct myopia, there are scientifically proven methods: glasses, contact lenses, or laser correction. However, it would also be wrong to completely reject exercises. Properly performed exercises reduce eye strain, relieve fatigue, reduce dryness, help the eyes recover after long work, but they do not eliminate minus. If you feel that your minus decreased after exercises, this is usually due to inaccurate measurement or temporary spasm. That is why, to determine the real minus, a special dilated examination with eye drops is performed. At Ko'z Nuri Eye Clinic, we diagnose myopia not only using a vision chart, but through full diagnostics. The length of the eye is measured, the focusing mechanism is examined, the retina is evaluated. Only after that is a precise conclusion made. If you are trying to reduce minus through exercises, write in the comments, how long have you had minus and which exercises are you doing? Do you truly notice results, or is it temporary relief? If your minus is increasing or you notice worsening vision, do not waste time. Visit Ko'z Nuri Eye Clinic for a full examination. Myopia that is controlled in time can be managed. Myopia that is postponed because of internet advice progresses faster. Eye exercises are useful, but they are not a miracle.